Welcome to the final video in Section 5 of our course, Understanding Mental Health, a WHO Mental Health Gap Action Program-inspired course for non-specialists. In the previous lessons, we've learned how to provide crucial support to those with depression through psychoeducation, lifestyle modifications, social support, and crisis management. We've also explored the importance of building a supportive network and providing immediate care during critical moments. Now we bring everything together by discussing one of the most vital parts of mental health support: referral and coordination of care. When someone is struggling with depression, especially moderate to severe depression, it's essential to connect them to the right professionals and resources that will ensure they receive comprehensive care. Why is referral and coordination important? Referral and coordination are critical because depression often requires multifaceted care. This might involve therapy, medication, support groups, or community resources. As a non-specialist, your role is to identify when professional help is needed and to coordinate access to the most appropriate treatment. By coordinating care, you ensure that the person receives timely and appropriate services. This also helps reduce the risk of relapse and further crises by creating a structured pathway to recovery. When should you refer someone for professional care? While you can provide initial support, it's crucial to know when it's time to refer someone to a healthcare provider. Here are some scenarios when a referral is necessary. When symptoms are moderate to severe. If someone's depression is significantly affecting their daily life, whether through physical symptoms, social withdrawal, or suicidal thoughts, it's time for a professional evaluation. When there is a risk of harm. If the person expresses thoughts of suicide or self-harm, immediate action and referral are needed. You should never try to handle a suicidal crisis alone. When the person's condition isn't improving, if someone has been following a treatment plan but is still feeling down or has worsening symptoms, they may need additional care, whether that's adjustment of medications or a more intensive therapy plan. When specialized care is required, if the person's depression is compounded by other mental health disorders, such as bipolar disorder, schizophrenia, or severe anxiety, a specialist will be needed to provide comprehensive care. How do you make a referral? Referral can feel like a complicated process, but it's simply about connecting the person with appropriate resources. Here's how to do it. 1. Discuss the need for referral with the person. It's essential to approach the topic with sensitivity. Start by explaining the benefits of seeing a mental health professional. You can say, "It sounds like you're going through a lot, and talking to a counselor or doctor could really help. They'll be able to provide you with more support and guide you through treatment options that might be a better fit." Ensure that the person understands that referral is a step toward recovery, not something to be feared. 2. Provide information and support with the referral process. Offer to help make the appointment. Sometimes just having someone assist in finding a doctor or clinic can make a big difference. Provide contact details for local mental health professionals, helplines, or support centers. If possible, accompany them to the appointment or provide transportation support. Coordination of care. Once the referral is made, your role in coordination is just as important. Ensuring the person stays connected to care is essential. Follow up with the individual after the referral. How did the appointment go? Or do you need any help with follow-up appointments? This can help reduce dropout rates and ensure ongoing support. Involve other community resources. Sometimes, individuals need more than just professional care. They may benefit from community-based programs, support groups, or even housing assistance. Make sure they have access to these services by connecting them with local support networks. Encourage ongoing participation in treatment. Mental health care is often long-term. Make sure the person understands the importance of regular follow-ups and sticking with the treatment plan. Let's pause for reflection. Think about someone in your community who may need a referral for depression treatment. What steps would you take to make sure they receive the support they need? How can you encourage individuals to remain committed to their treatment plan and avoid feeling alone in the process? Referral and coordination are essential for creating a continuum of care that leads to lasting recovery. A real-world example, Jane, a 38-year-old mother from Port Harcourt, has been feeling overwhelmed by depression for several months. Her community health worker has been offering support, but Jane's symptoms aren't improving, and she expresses occasional thoughts of self-harm. The health worker recognizes that Jane's condition needs professional attention, so they gently discuss the option of seeing a counselor or psychiatrist. They help Jane book an appointment at a nearby mental health clinic, and the health worker offers to go with her for support. After the appointment, Jane receives a prescription for antidepressants and starts weekly therapy. With regular follow-up and encouragement, Jane begins to feel better and continues her treatment plan with renewed hope. In summary, referral connects individuals to the right professional care and ensures they receive appropriate treatment. Coordination of care involves providing support and follow-up to help the person stay connected to the services they need. As a non-specialist, your role in both referral and coordination is essential for creating a comprehensive treatment plan that includes ongoing support. This brings us to the end of Section 5, where we've explored practical approaches to supporting individuals with depression through psychoeducation, lifestyle modifications, social support, crisis management, and coordinated care. In the next section, we'll move into advanced mental health interventions and explore how to apply cognitive behavioral techniques and community-based mental health models. Before we continue, here's your final reflection for today. How can you ensure that someone you're supporting gets connected to the right care? And how will you help them remain engaged in the treatment process? Let's continue strengthening our knowledge and compassion to build healthier communities.